it is my pleasure to move us into one of our highlighted sessions for today. And this is going to be, it's a featured panel discussion on aging and people with intellectual and developmental disabilities. This is going to be a really important session. It's becoming a really important topic nationally, and especially here in California. And the session will examine the supports and needs of people with disabilities who are aging and the additional challenges posed when they're living with aging parents or guardians. In the most recent decade, 2008 to 2018, for which the data is available, the number of Californians with intellectual and developmental disabilities over age 52 who live at home with their parents increased from 73 to 79%. At the same time, the number of people in that same age group grew by over 12,000 individuals. Clearly, these are households with 2 or more individuals who are entering the stage of life when new and different types of support will be needed to allow them to safely remain in the family home. The session will include a review of policies currently in place with the Master Plan on Aging in California, and then policy changes that will enable us to comprehensively address the needs of the population. Before I introduce our presenters one more time, I'm going to have Chip come on. For those that this is important for MCLA continuing education credits, here's a quick introduction of that.
Once again, this session is being co-sponsored by the Golden State Pool Trust and is eligible for the minimum continuing legal education credits. The MCLE credit is approved by the State Bar of California and the North Bay Housing Coalition. We will read a code during this session, and you must include it in the post-session survey for your credit. Again, we will read a code at a random time during the session, and you must include it in your post-session survey for credit. Thanks so much.
And if you have no idea what Chip is talking about, then you shouldn't worry about it at all. It doesn't mean anything for you. It's just for a certain number of people here. So I'm thrilled to introduce our presenters. First, it'll be Nicole Jorwic, the Senior Public Policy Director of the ARC of the United States, and Amanda Lawrence, Project Director for the California Department of Aging. Nicole is an accomplished special education attorney and an advocate for students with disabilities with a focus on transition-aged youth. Nicole received her JD in Child and Family Law Certificate from Loyola University of Chicago. She received her BS from the University of Illinois. Nicole has a brother on the autism spectrum. And Amanda Lawrence is the project director of the Master Plan for Aging at the California Department of Aging. Immediately prior to joining the California Department of Aging, Amanda served as strategist and program consultant on several projects at the California Department of Public Health, including the launch of the department's Healthy Aging Initiative. Following graduation from the University of Wisconsin-Madison, a passion for health and social justice led her to earn her Master's of Public Health and to work for international community-based and healthcare nonprofits promoting health and equity, including the planning and implementation of community organizing efforts with and for older adults in Nicaragua. I'm thrilled to introduce you guys and to have you here with us to discuss this really, really important topic of aging, and specifically aging for people with intellectual and developmental disabilities. Amanda, I'm going to hand it over to you first to just discuss the Master Plan on Aging in California. And thank you so much for being here. Oh, Amanda, you are.
Hi, thank you. I'm going to go ahead and share my screen. Is that working for everybody? Thank you. So very happy to be here. As Jordan just explained, California is going through some changing demographics regarding our age groups in California and across the world, really. So in August 2019, recognizing that California's over 60 population is projected to diversify and grow faster than any other age group, Governor Newsom signed an executive order calling for the state to develop a master plan for aging. Advocates have long called for this plan, so it's well overdue. And we're so excited to share that we launched this plan on January 6th, earlier this year. Now, this plan is a blueprint to prepare California to ensure that all residents have opportunities needed to thrive as we age. The plan I'm going to share with you is not just a plan for older Californians. It's truly a plan for all Californians, regardless of age, race, ethnicity, ability, location, because we are all aging, of course, and we all are influenced by aging and older adults in our lives. I'm going to move to the next slide. So just a little bit of background on the shifting demographics. So California actually has the second longest life expectancy in the nation. It's almost 82 years old, and unfortunately might see some shifts in this due to the COVID-19 pandemic, but we are still leading the pack in the country regarding life expectancy. There are, of course, disparities in that life expectancy, and this plan shares some strategies to help shorten and alleviate or eliminate that disparity in life expectancy that we see across the state. So aging is changing us personally, it's affecting our lives personally. We think of caregiving and retirement planning, healthcare, living arrangements, but also on a societal level. We have to think about our policies, healthcare, long-term care financing, community planning, pension systems. So our existing society really was built based on outdated demographic breakdowns and assumptions and stereotypes about what later life actually looks like. And we know that aging is absolutely changing for everyone, and we're experiencing it differently, and we're living longer than ever before. So there's an obvious need to rethink and redesign how we design systems and structures so that we can better serve everybody. So California actually has more multi-generational households than any other state. We do have the fastest growing older adult homeless population though. And we do have 2 million older Californians who are economically insecure. So there is a lot of work, there are a lot of challenges, but there's also opportunities and things to celebrate about aging. I do want to note that by 2030, Californians 60 and over will comprise 1/4 of the population. So back in 2010, there were more people under the age of 25, but by 2030, the number of people over age 60 will actually outnumber them. And we also have a diversifying population. So California's older population is becoming more racially and ethnically diverse than ever before. In 2010, adults over 60 were majority white, non-Hispanic. By 2030, this white majority non-Hispanic population will have moved into a minority. So, and by 2060, only about 24% of older adults will be white, non-Hispanic. And this has several implications regarding programs, systems, and policies. We have a lot of work to do in improving our cultural competency and responsiveness in our data collection, in our research, our workforce development, and public policies that we can use as tools to advance equity in aging. So I hope that you'll see throughout this plan I'm about to share with you that equity was really baked in throughout the entirety of it. So a little bit about how we got here first though. So in order to design this plan, we had over 1 year of intense stakeholder and public engagement. We had surveys, we had public meetings, we had public roundtables to really garner impact from the public. We also had strong stakeholder engagement. We had 4 stakeholder advisory committees for the master plan. 1 overall advisory committee, we had 1 focused on long-term services and supports, we had 1 focused on equity, and we had 1 focused on research. We also aligned our work with the Governor's Task Force on Alzheimer's Disease and Prevention and Preparedness. You'll see a lot of alignment and overlap in our recommendations and in our master plan and the recommendations that that task force put out. And of course, lessons learned from COVID-19. We had to pivot. Originally, we wanted to release our plan in October, but of course, all of our older adult services, our stakeholders, and of course, personally, we had so many different ways that we had to change how we were living and operating. So we spent a lot of time shifting our services, creating virtual access, and we really took to heart all those lessons that we've learned during that time, because of course, COVID-19 did nothing other than highlight those gross disparities and inequities that exist for older adults, people with disabilities, and particularly people of color. So moving forward, our hope is that we can take this innovative thinking and the way that we've quickly shifted to provide services for older adults and people with disabilities and move that forward. And we also have a cabinet work group. So none of this would get done if we didn't have strong buy-in, of course, within the administration. So as we developed this plan, we took all of our stakeholder recommendations to our cabinet work group, which had the secretary from every agency across the cabinet involved, and they signed off on 132 initiatives to move this plan forward in the first 2 years. So the plan is comprised of 5 goals. Our first goal is housing for all ages and stages. Our second goal is health reimagined. Our third goal is inclusion and equity, not isolation. Our fourth goal is caregiving that works. And our fifth goal is affording aging. Every goal has strategies underneath it, and every strategy has several initiatives to be implemented within 2 years. It is, however, a 10-year plan. I'm going to go through each goal and share some of the highlights. So for goal 5, our goal here really is that we will all live where we choose as we age, in communities that are age, disability, and dementia friendly, and climate and disaster ready. So we have a target of building millions of new housing options. For every goal in our plan, we featured a local model. Here we have Age Well San Diego. They have a fantastic multifaceted aging plan, but we really highlighted them here because of all the work they're doing to promote accessory dwelling units, or ADUs. They've become more popular. This allows people to afford a home, to live, let's say, with in-laws or other members of their family, to have a caregiver live in their ADU. So lots of reasons why we need to explore different housing options, because every stage of our life might call for a different type of housing that supports our needs. Within this strategy, we do have several initiatives. So, and we really want to focus on increasing the availability of housing with health strategies attached to it. And we actually are building on the adult family homes model that's currently for adults with developmental disabilities. So, and thank you for that leadership in that realm. We feel like this model could really be explored and expanded upon to serve aging adults, including those with dementia. We're also looking into and identifying innovative models and solutions to enhance the technology in housing so that everyone can age well and have access to those tools and resources to maintain health. In this area as well, it's not just housing as in the structure we live in, but also transportation. We really want to promote the expansion of bus and transit stops that are age and disability friendly, such as the location, the seating options, protection from the weather. We are interested and really want to promote and work with California State Transportation Agency to establish person-centered MOUs between transit districts that allows paratransit to cross transit district lines to meet riders' needs. Right now, we hear about a lot of people needing to get a different pass. It becomes very complicated to get from point A to point B because they go through so many different districts. We also just want to encourage innovation in flexible transit options, for example, on-demand response, especially in rural communities. In this goal area is also outdoor and community spaces for all. We want to use public and private park funds to develop age and disability friendly activities for people of all ages, such as slow streets, smart tech enhanced parks, parklets for placemaking. And then we also have emergency preparedness and response and climate friendly aging in this goal area as well. And sadly, older adults and people with disabilities often have the highest death rates in emergencies and disasters. So conducting after action analysis of COVID-19 is one of our initiatives for 21-22 in here. Improving our online emergency tools for the disabled and at-risk adults and their caregivers. Increasing the amount of languages we offer these tools in. So that's just a snippet of what goal 1 looks like. Goal 2 is health reimagined. We want everyone to have access to the services that we need to live at home in our communities and to optimize our health and quality of life. And our target here is to close that equity gap and increase life expectancy. We've highlighted a couple of local models here as well who are doing great work with healthcare foundations and healthcare plans and offering services such as chronic disease management classes. in this goal area, you'll see strategies like bridging healthcare with home to address the expansion of accessibility of long-term services and supports. We also have in here that we will advocate with the new federal administration to create a universal long-term services and supports benefit and assess opportunities for federal and state partnership. If you are interested in this line of work, you would probably have heard Milliman study was released, the actuarial study assessing the long-term services and supports benefit. We're also looking to Washington State, who has a great model. And then we also want to expand access to home and community-based services for people receiving Medi-Cal via CalAIM by implementing in lieu of services such as housing transition, navigation services, nursing facility transition, home modifications and medically tailored meals and more. You'll also see health education campaigns, awareness campaigns, improving our cultural competency as we try to reach out to our communities. You'll see a lot in here about dementia and Alzheimer's disease. That's our strategy E. So we really would like to really improve dementia research, diagnosis, screening, treatment, and education. We included a lot of, we will be seeking a lot of stakeholder feedback on models of care coordination for IHSS participants with dementia or cognitive impairment, including assessing options to increase adult day services, especially for people with dementia. We're also looking to bulk up and continue California's leadership and commitment to target clinical research into Alzheimer's on gender and racial disparities and develop a plan for an equity-focused dementia prevention public campaign. We'll move on. Goal 3, inclusion and equity, not isolation. We really want to make sure that everyone has these lifelong opportunities to work, to volunteer, just to be socially and meaningfully engaged, and to take on leadership roles if they would like. And in here, we've also included protection from isolation, discrimination, abuse, neglect, and exploitation. We know during COVID-19, isolation was of a grave concern. We had a lot of older adults, a lot of people, aging adults, who felt disconnected from their families, who were disconnected from their families. And so we have in here strategies such as closing that digital divide, not just expanding broadband access, but expanding people's abilities to use the tools and technology available and ensure that people have those correct tools and technologies for their abilities and needs. We have in here also, consistent with the Future of Work Commission, exploring ways to promote flexible work models, especially for people who are aging, who are experiencing a disability, or who have retired and would like to maintain that sort of engagement in the workforce. We also have in here providing assistive technology equipments and devices available to workers with disabilities to meet the need and advance equity. And volunteering is also important. So we're going to work with Cal Volunteers. We want to ensure that volunteers in California really showcase and embrace the diversity of Californians. So we really want to include older adults, people with disabilities. We want to ensure that everyone has this opportunity to meaningfully serve others in a volunteer role. And then I'm really excited, and this was in the governor's budget, was that we will be creating a leadership position on aging, disability, and Alzheimer's, and that would be a position held within the governor's office. So another initiative in here is to consider the stakeholder recommendations and opportunities to broaden this master plan into a master plan for aging and disability, or a master plan for disability. This recommendation came from our stakeholders representing the disability community, because we knew that the master plan for aging wasn't going to address all of those needs, really address everything that the disability community wanted to see. And so we've met several times, and we decided that we would move forward with those stakeholders and to broaden this plan or create their own plan moving forward. So more to come on that. Caregiving, goal 4, caregiving that works. So not only do we need trained caregivers, but we need more caregivers. We want to be prepared for and supported through the rewards and challenges of caring for aging loved ones. Our target here is 1 million high quality caregiving jobs. We actually need that many new caregiving direct care jobs in California to meet the demand. Great model in Contra Costa County is Healthcare Career Pathway. Strategies in this goal area are family and friends caregiver support. So we really want to do things like promote state paid family leave benefits for older Californians, people with disabilities, and family caregivers. We want to develop options to include family caregivers in the home and community assessments, and consistent with CalAIM, expand a respite for family caregivers. Also, of course, want to create those good caregiving jobs. People need better pay, better training, better opportunities to climb the ladder in this care workforce. We need to add online training. We need to just provide opportunities for both family caregivers and professional caregivers to have access to dementia training. We want to diversify that pipeline for direct care workers we're going to test models like healthcare career pathway and expand those as feasible. And then virtual care expansion. We want to expand access to telehealth. It's been absolutely imperative to get through this pandemic. Not everyone is comfortable with it, but we want to be able to use it as much as possible moving forward to increase access to care. Also increase access to those personal and home technologies that promote healthy aging. And then goal 5, affording aging. We will have economic security for as long as we live. Our target here is to close the equity gap and increase elder economic sufficiency. A couple of great projects that we highlighted were San Francisco's response to the pandemic with their meals expansion and the Project Home Key, that work they did to house the homeless, but also particularly did a great job with older adults. So strategy A is end homelessness for older adults. We want to expand programs like that Home Safe and Housing and Disability Advocacy Program. We also want to advocate with the new administration federally to assess the Social Security gaps for California's diverse workforce, including caregivers, farm workers, and more. And as far as promoting income security, we want to continue to promote CalAble. I know Dante Allen, Executive Director of CalAble, I think is on after us. We also want to promote CalSavers. There's definitely ways we can improve our culturally informed and responsive ways of doing this sort of outreach to communities so they can truly start investing for their future. And as a part of the Master Plan for Aging, I would like to point out that we created a local playbook. It is available on our website, and this is really a way that local organizations, local government, philanthropic organizations can build out a master plan for aging in their own community. Whether it's focused on a small project or a broader aging and disability friendly framework, there are 7 steps that we take each user through, beginning in planning, down to evaluation, and then of course sharing your stories so that we can learn from each other. And then we also have a data dashboard for aging, and it allows us to monitor the master plan as we move forward over the 10 years. And we're making it as user-friendly as possible. And if you go onto this website, which you can access through the Master Plan for Aging's webpage, you can find demographic data and print out a demographic snapshot for your county. But we also have built out approximately 40 indicators that are in alignment with each of our 5 goal areas. And we're constantly enhancing this dashboard. It's definitely in version 1.0. We have lots of data to add. We'll continually update it as the data sets become available. And we're always open to feedback and comments and suggestions for how we can build out this dashboard to be more useful for people on the ground in their planning. So a little bit about next steps. It's a big plan. It's 10 years, 5 very bold goals, so many initiatives. We will continue to work with the cabinet within the governor's office in strong partnership with our local leaders, our stakeholders, private sector, and federal government to launch those 132 initiatives that we've laid out for the first 2 years. We will have several committees formed to oversee and advise the master plan for aging implementation. There will be one focused on equity in aging. They met yesterday for the first time. We are also creating an Elder Abuse and Justice Coordinating Council. And we'll also have a committee sort of based on the Olmstead Committee to really focus on that community living aspect for people with disabilities and aging adults. The governor's budget, plenty of targeted new and continuing investments in aging. Really excited. We've got money for the California Department of Aging to implement the master plan. We've got money for Alzheimer's research, expanding all sorts of Alzheimer's services and supports. That senior advisor on aging, disability, and Alzheimer's disease has been funded. Adult day resource centers have been expanded. Investments in multi-service senior program and Hcbs to modernize those. So a lot of money to modernize the way that we serve older adults and people with disabilities in this state, including creating a framework for the creation of an LTSS benefit. And then my last thing here on this slide is if you click on that link, if you're able to, several pieces of 2021 legislative bills. Justice in Aging, a fantastic advocacy organization for older adults, put together that compilation of bills related to the MPA. Great resource. So that is that's a snippet, that's a snapshot, an introduction into the master plan for aging. You can sign up for our newsletter. We send out about once a week on updates for the master plan. And then you can always send questions and comments to engage@aging.ca.gov. That concludes my presentation. So I hand it over to Nicole.
Thanks so much. Thanks so much. And it was really great to hear, and I will work on sharing my screen. It was great to hear about what's going on at the state level, and so much of it doesn't always work out, but it's nice to hear that it's working out, that there's some federal alignment with what is going on, the great work that's going on in California. So really glad to be hearing about that.
Nicole, while you're getting your screen up there, if you don't mind, I'm going to break in and give everyone their MCLE code. The code for this session, so please write down, is 2290. Again, the MCLE code for this session is 2290. Thanks so much. Back to you.
Thank you. And I'm having trouble starting the slides. Because I can't. There we go. Sorry about that. There we go. Okay, assuming that you all see the screen, I am going to get going, and I'm going to power through some pieces and really focus on some of the policy changes as well. But first, I want to talk a little bit about the demographics. I won't talk about my story, but I'm also a family caregiver. I'm a family member. That's my brother, Chris, who has autism, as Jordan mentioned at the top. So I obviously understand that people with IDD are aging like everyone else. And there's a different set of issues and also a really important other factor, which is the fact that so many people with disabilities who are aging are also living with aging family caregivers. But first, you know, I know Jordan talked about some of the numbers in California, but nationally, these are some numbers from Dr. Tamar Heller at University of Illinois, Chicago, that the numbers around people with developmental disabilities over the age of 60 is expected to be over 1.4 million or higher by 2030. And so this is not a problem, it is an issue that we know is going to continue to grow, that we really need to make sure that we have distinct and designated policy solutions around in order to make sure that we're taking care of the unique needs of people with IDD who are aging. People with IDD often, before aging and also into aging, have a variety of needs that need to be addressed in order to access care. There's several comorbid conditions, including obesity, also high incidence of dementia for some with some disabilities, some diagnoses, and all of these pieces can be difficult to diagnose for a variety of reasons, including the fact that medical care isn't always appropriately received, or providers don't always necessarily understand the needs of people with disabilities, but that's obviously continues to improve and needs to also do that. We also need to can be mindful of behavioral health and other mental health concerns as people with disabilities age. We have to make sure that we are creating policies and practices to support healthy aging, making sure that we're supporting the development of healthcare self-advocacy skills for people with disabilities, making sure that we're providing information in plain language in a way that is accessible so that people people with disabilities can be their own best advocates and understand the changes that are occurring, whether it's in healthcare or in service settings. It's also important to educate all stakeholders. And as I mentioned, I am a family member, and I can say that as a family member that sometimes it's really important to make sure that the same messages that may be happening at a job site or a day program or in a group home is also, there's buy-in from all members of the person's life, including their families. And so it's really important that there's a focus on that. When it comes, I was talking a lot about acute care, but also, as Amanda was just pointing out, there are a lot of needs around long-term services and supports, or LTSS. Fundamentally, the biggest issue there is around access to appropriate home and community-based services. Many people with IDD are aging and living with aging family caregivers because there is not enough services and not enough infrastructure in the home and community-based service system to provide everyone with all of the services that they need in order to live either in their homes or in other placements within their communities. And it's also important that when we're thinking about long-term services and supports, that we're not just thinking about the wraparound services, but that we're also talking about the physical location, including any environmental changes that may need to be made, assistive technology and other remote supports that might support independence, but also provide that security for an individual and their family, making sure that we're talking about all of those pieces so that people who are aging with disabilities and their aging family members can feel secure. We know that there has been a shift, and obviously the COVID pandemic has put a spotlight on some of the reasons why there have been some shifts in where services are being provided. There are historical models of service. Obviously, I know California just, you all just closed your last institution, so I know it's not an issue in California, but there are still 36 states that have institutions open. There's still a lot of people with disabilities who are living in nursing homes that would prefer to live in their homes and communities. And so we need to make sure that we're shifting that to, again, having enough access for those home and community-based services. Because if not, and the system that we currently rely on is a system where people with IDD are majority, as Jordan pointed out at the top, are living with those aging family caregivers or other family members. And this is really a major problem that frankly, that from a congressional standpoint at the federal level, we've really been kicking the can on. But you timed the session really well, because I will have some hot off the presses information to share in a moment. So the current system, again, has this over-reliance on aging caregivers because we don't have a robust system of HCBS. Medicaid, which is called, I know, Medi-Cal in California. It's part of the confusion is that it's called a lot of different things in different states. But Medicaid is a state and federal partnership that has both state and federal dollars invested in providing long-term services supports. When it comes to providing those services, Medicaid is really the only game in town. Medicare only covers short-term, long-term care stays. Medicaid or private pay is really all you're going to see for HCBS. We know at a national level, there's over 1 million people waiting on waiting lists for these services. And we also obviously know that there's a workforce crisis. So all of those pieces need to be addressed from a policy perspective to make sure that aging individuals with disabilities and also the aging family caregivers have peace of mind and access to the services that they need. We're coming out of, thankfully, a time when we were doing a lot of advocacy at the federal and the state level around ensuring that we're protecting the integrity of the Medicaid program, that state and federal partnership, and making sure the guarantee for those services were not eliminated. That was what we were facing in 2017. And in the last year, obviously, in the face of the pandemic, we saw that there could also be a real risk. I know in California, there were some troubling proposed cuts that luckily didn't end up coming to fruition, but those were the kind of things that we were really worried about. because we really need to shift to from protecting Medicaid to modernizing Medicaid. And what I mean by that, first I just have to do a 2-second Medicaid refresher. So again, this is a state and federal partnership. There's an agreement between the state on who's eligible. The state, there's a federal floor for those services. So there's a federal law and a federal match, federal matching assistant percentage. Varies between 50 and 75% depending on what states you're in. California's is definitely, I think, pretty much close to 50. Medicaid was a system, the federal law was passed in 1965, so it's a very old aging system, and it also has some biases, and that includes that under the federal Medicaid law, institutional services and nursing home services are mandatory under the law. And so it's not a state decision, that's a federal law. Whereas home and community-based services, so group home supports, individual supports in your own apartment, day programming, etc., those are all optional. And so that's always why we've been really concerned when there's been large cuts talked about, or a lot of stress on the Medicaid program overall, is that those fundamentally important systems and services that people with disabilities and their families rely on, especially more as they age, had been at risk. So there's been a couple different federal policies that we continue to watch that can expand access to those home and community-based services, which really is going to be the most important thing to support aging people with disabilities and aging caregivers. Money Follows the Person is a program that just got reauthorized for 3 years at the end of 2020. And actually a bill to permanently reauthorize the program was just introduced at the end of last week. Money Follows the Person is a program that puts 100%, so 100% match, 100% of the FMAP for the first year to move people with disabilities and aging adults. So it's a both and, out of more segregated settings like nursing homes and institutions and back into the community. So it's a shot in the arm for those services. And we're hopeful that the program will be made permanent because, again, as we saw the dangerous nature of those facilities where a third of the deaths during COVID occurred, we really need to make sure that we're supporting people getting out of those systems and building the capacity in the community. Hcbs Infrastructure Act. So Jordan mentioned that the after a year of advocacy, but very thankfully, the American Rescue Plan that was signed into law by President Biden last week did include a dedicated FMAP or federal match, so an additional 10% of federal dollars to support Hcbs for 1 year. So as I've been saying on the Hill and with the administration, that is funding that should have passed a year ago. And so when we look to recovery, which is the next package that we're expecting to see at the federal level, we need to come up with a middle ground. We've been using the analogy that the American Rescue Plan money was getting us to the airport. Another bill that I'm going to talk about in a moment is kind of the total destination. And in recovery, we need to see more funding go into states through something like the Hcbs Infrastructure Improvement Act, so that we can also expand services. Because the reality is that we know that that 1 year funding is likely just to get state programs back to baseline. So the Hcbs Infrastructure Act, really quickly, is originally drafted, but we'll be working on making it bigger, is a 7-year grant program meant to work in the areas of supporting the Hcbs settings rule implementation. That's the federal rule that says where home and community-based dollars should be spent, meaning that they need to be integrated services, housing, employment, the workforce pieces, and also case management, which is a carryover from a prior program. It's a 7-year program meant for every state. Again, we're going to be working on plussing that up because the total cost of the Infrastructure Act is even less than what the investment from the ARP was. So we need to make sure that it's even bigger. And so that's what we're going to be pushing for, along with working with our colleagues in labor, including we're working very closely with SEIU around also workforce support. So the recovery package needs to include both services and workforce supports so that we can build instead of just get back to baseline. And the ultimate destination and the ultimate piece, I made this slide deck before I was able to say anything publicly, but we have the beginnings of a solution that will really change the game when it comes to services for aging adults with disabilities and their families. And that's a bill that was introduced yesterday by Senators Hassan, Brown, and Casey, and Representative Dingell. It was introduced as a discussion draft. We expect full introduction over the summer, and it's called the Hcbs Access Act. I talked about how currently segregated institutional services are mandatory, while home and community-based services are optional. And this bill would change that. It doesn't flip the bias, but it just puts institutional services and home and community-based services on equal footing. We're very excited. It's going to take a long time to get this done because it's a huge federal investment, meaning it costs a lot of money. So it's going to take all of disability and aging and advocates and also the general public understanding why this is important to really get it done. But we're really, really happy to see it out there in the world. Our staff have been working on the legislation actually, oddly enough, since before COVID happened, for about 18 months, and couldn't be coming out at a more important time. This is all going to be incredibly important from a policy perspective. And it's also important that when we're looking at research that we're not leaving out the unique needs of people with IDD who are aging, including making sure that their unique needs are part of IDD and dementia research and care, improving outreach to the caregivers of older adults and making sure that family caregivers are also getting what they need. And I know that you all got this in a handout, so I will buy through this piece. But again, focusing on integration, making sure that there's continuous care so that ultimately it's about peace of mind. And I know at the ARC, we have our Center for the National Office, we have our Center for Future Planning. And these are real concerns and fears that obviously I understand as a family member. And so we need to make sure that we have research that backs up the policies that we need in order to get the services that everyone needs in order to access the services that they need to thrive. We're going to be having a lot of resources from the national office that will be coming out around the bill that I mentioned. Also opportunities to share your stories with legislators at the national level. We've also been, as Jordan knows, passing along plenty of state level resources to help make sure that the funding that's flowing is going into the right places to support people with disabilities of all ages and their family caregivers of all ages. This is my contact information. I'm pretty good about getting back to email, so feel free to shoot me an email if you have any questions. It was really great to be on with you all, and also really loved Sasha's performance. That was definitely a highlight for me. So thank you, Jordan, and thank you, everyone.
Thank you so much, Nicole and Amanda, for talking about this really important topic, aging in people with disabilities, and specifically people with intellectual and developmental disabilities. And we have had great questions. We've been answering them through your session, and we are a little over time, but let me ask one, if that's okay. Nicole or Amanda, are there efforts that you know about to include self-determination and supported decision-making for older adults with intellectual and developmental disabilities?
You want to know about advancements? And sorry, I was answering another question in the Q&A. Advancements
Yeah, no problem. If there's efforts to include self-determination or supported decision-making for older adults with disabilities in that process and what they want to do, how they want to live out their older years.
Sure. So from a federal perspective, all services should be provided under a person-centered plan, which obviously promotes self-determination. So that's the self-determination side. Supported decision-making is obviously a legal alternative to guardianship. And those are all state, guardianship laws are all state-based. So I'm sure that there's things that are happening, but I don't know if Amanda, if there's anything going on in California specifically around that.
So that actually is a part of one of our goal areas, I believe, healthcare, Health Reimagines. We have in there initiatives related to improving people's ability for self-determination. We've been working with public guardians, conservators, and we are building out a new Office of Patient Representative to help bring those forward for those folks who haven't had the ability to have their needs or wants recognized. Advanced care planning is also part of the master plan.
Well, thank you both so much for talking about this really, really important topic. And I know this is just going to become a bigger priority for the disability community as the years continue and the aging population continues to grow. So thank you both again so much for being with us at our important public policy conference. Thank you.